Observers and citizens are convinced that the number of deaths from COVID-19 in China far exceeds the number reported by China's regime. Many Chinese people have boldly told the truth that the Chinese Communist Party is said to be trying to cover up. Shanghai residents told Xinjiang that the pandemic in Shanghai was severe before the Lunar New Year. Hospitals and funeral homes are so overwhelmed that the remains must wait months for their turn to be cremated. Officials dare not publish the actual data. Huang, a Shanghai resident, said that too many people died, so the price of cremation went up. The funeral home must burn 10 people at a time. Sun, another Shanghai resident, said that many dead people in the Shanghai countryside are not cremated, so their relatives put each body in a pit and then cover it with soil. Many dead have not been buried, so the living and the dead are next to each other. Wang, a farmer in Hubei, said that medical conditions in rural areas are very poor and the death toll in this COVID outbreak is several times higher than usual. Wang, a farmer in Hubei, said that medical conditions in rural areas are very poor and the death toll in this COVID-19 outbreak is several times higher than usual. Zhang is a former cadre in the political system of the CCP. She revealed that the official statistics released by the CCP are all false. She added that no one dares to tell the truth because if they do that, they will be arrested and imprisoned by the CCP for spreading false rumors. The former civil servant revealed that there was a joke among the employees of the China Statistics Bureau that under the leadership of the CCP, all the data was wrong except for the date. According to Xinjiang, the authorities of major cities such as Beijing and Shanghai have not announced the number of remains cremated in the fourth quarter of 2022. This raises suspicions that the Chinese authorities are trying to cover up the number of fatalities from COVID-19.
And then, of course, the fact that Russia and China are coming closer and the significant investments by China in new advanced military capabilities just underlines that China poses a threat, poses a challenge also to NATO allies.
周三，北约秘书长斯托尔滕贝格在东京庆应大学发表演讲时强调，中共威胁不仅是区域性的，更是全球性的。
Beijing is substantially building up its military forces, including nuclear weapons, without any transparency. It is attempting to assert control over the South China Sea and threatening Taiwan, trying to take control of critical infrastructure, including in NATO countries.
斯托尔滕贝格还说，俄乌战争持续，莫斯科和北京的关系日益密切，令世界担忧。去年12月底，中俄双方刚刚结束了在中国东海附近进行的联合军演，被认为是对北约及其盟友的直接威胁。为应对中共挑战，北约加强了与日本和韩国的安全合作。周二，斯托尔滕贝格与日本首相岸田文雄达成共识，将共同捍卫国际秩序。
自由で開かれたインド太平洋の実現を含む法の支配に基づく自由で開かれた国際秩序の維持強化のため、日 NATO 間協力をさらなる高みに引き上げていくことを確認をいたしました。
不过，斯托尔滕贝格表示，仍不会将北京视为对手，而是进行防御。之后，双方发表联合声明，表示主要在俄罗斯核武器、中俄军事合作以及朝鲜核威胁方面进行防御战略，并强调，目前北约及其盟国面对的中共威胁是二战结束以来最严峻、最复杂的。新唐人电台记者陈悦综合报道。
After the end of the zero-COVID policy in early December, China had a spike in infections to such an extent that it triggered a drug crisis. Interestingly, in Hong Kong, an unusual case of patients ordering drugs on behalf of others has emerged, raising serious suspicions among doctors. What is going on? Or rather, who is behind this? On January 30th, South China Morning Post reported that doctors on the island administered by the Chinese regime detected strange behavior among patients. The Hong Kong Medical Association said that it observed several patients going from doctor to doctor asking for antiviral drugs for COVID. This situation has occurred since mainland China resumed overseas travel in early January. It was also reported that people have been asking for 2 antivirals registered and available in the city, Pfizer's Paxlovid and MSD Pharmaceuticals' Molnupiravir. Pfizer's drug is not readily available, and Molnupiravir was unavailable until this month. Both are in short supply in China. Hong Kong residents can get antivirals for free from public hospitals, clinics, and even specific private practices. While non-residents can get them from private hospitals or clinics, paying for each treatment is more than 6,000 Hong Kong dollars or $700. Dr. Victor Yuang Hip Wo, vice president of the Hong Kong Medical Association, explained that there is a possibility, a loophole in the government's electronic health record sharing system. This is a platform used by public and private doctors to access patients' medical records as new prescriptions are not updated quickly. In the words of the healthcare professional, some patients take advantage of this loophole to obtain more medications. An individual can impersonate other patients on the same day and even with the same doctor to request more medicine through online consultations. It was also detected that these people were from different surnames claiming to belong to the same household and obtaining medicines from the same professional. It is difficult for doctors to know which patients come from and same households because it is generally not an obligation to prove your permanent address, so cases were seen of different people claiming virus treatments in the name of others. As mentioned at the beginning, the motives behind these people are unknown. Still, the local medical association suspects it is an organized activity and urges an investigation. For almost 3 years, the Chinese Communist Party maintained the world's strictest control on COVID. Mass testing was ordered, and major cities, such as Shanghai, were shut down for months until many protests broke out in November. Following the relaxation of restrictions came waves of infections that led to medicine shortages, another problem facing the Chinese people, and several people are believed to have resorted to underground markets to get the treatments.
It can be illegal to protest if you cause serious.
And if the government doesn't do something about it, I think we'll see more days like today with more and more unions joining in.
When do we want it? Now! What do we want? Pay rise! When do we want it? Now!
When do we want it? Now! What do we want? Pay rise! When do we want it?
Since the sudden lifting of the lockdown by the Chinese authorities at the end of last year, the pandemic has been raging in China. There are still long lines at crematoria in many places so far. Chinese language media outlet Xinjiang interviewed some local villagers, officials, and netizens on January 31st. A popular video on the internet shows that after the Chinese New Year, funeral homes in Yunnan, Hubei, Guizhou, and other places are still overcrowded, and there is a long queue of vehicles outside the funeral home in Linyi City, Shandong. Yin, a Shandong-based villager, said that he saw 3 houses holding funerals when he went out the day before. Yin said a large area of the local area was infected, and many people died last year after the authorities relaxed the pandemic prevention measures. According to Yin, every village has dozens, hundreds, or even a continuous stream of funerals. The number of coffins has risen to more than 10,000. Not only the elderly, but also children died. Yin said there were people in their 20s, 30s, 40s, or 50s. A 36-year-old person passed away 2 days ago, while 2 other young people from out of town also died. According to the villager, hospitals were overwhelmed and people couldn't buy medicine. Moreover, many people passed away because of the hospital's chaotic operations. Yin said these hospitals didn't have ventilators. They couldn't categorize the patient's status to prioritize the severe cases. Li, another Shandong-based villager in Binzhou city, also referred to the situation about his town. Besides the stories of these villagers, the emptiness of the Shandong high-speed train during the Spring Festival surprised many. As Chinese media Xinhuang reported on January 23rd that the station was empty, many internet users questioned where people had gone. The pandemic situation in China's rural areas is tense at the moment. However, the Chinese officials continue to conceal the data. According to Chinese language media Xinhuang, the reported death toll was nearly 80,000 cases within 50 days after December 8th. Moreover, on January 28th, the Chinese Center for Disease Control and Prevention reported that 6,364 people died in hospital in the previous week. But Xinhuang's reporter learned different information from the White House. According to National Security spokesperson John Kirby, China has not been fully transparent and we cannot comment on the veracity of these figures. We urge China to be fully transparent about what is happening. Some netizens confirmed to the reporters that there was no need to report because the data was seriously inaccurate.